Hi, my name's Tyler. I will be your nurse today. I will be performing a head-to-toe assessment on you. And if any which time you feel uncomfortable or you're in any pain, let me know and we can stop. I will be doing 4 different techniques: inspecting, percussing, palpating, and auscultating. I will note that I performed a skin audit prior to this assessment, and patient's skin is white, it's dry, there's no abnormal lesions, moles, or lumps or masses noted. Vital signs, height and weight are within all within normal limits. So I'm gonna note that whenever patient walked in, she was steady. She had no involuntary movements. Her balance was steady. No unsteady gait. I would note that her posture, she's sitting in chair with her hands erected aside. She's smiling. She's happy to be here. She is A&O ×4. I've already washed my hands. I've introduced myself. I pulled the curtain for privacy. I've explained what I'm going to do. I'll identify the patient. Can you tell me your name and date of birth?
Clarissa Carlisle, 5/20/96.
Okay, and do you have any allergies?
None.
Okay, good. So I've done my YPA. I'm going to go ahead and note that she is dressed appropriately for the season. So we're going to go ahead and get the cranial nerves out of the way. So there are 12 cranial nerves. So the first cranial nerve is olfactory, and that's a smell test. So I'm going to have the patient close her eyes and let me know what she smells. I'm going to plug one side of her nose, and she's going to tell me what she smells, okay? So can you close your eyes for me? And what do you smell?
Nail polish remover.
Okay. Do it again, and then let me know what you smell.
Gotcha.
Okay, good. So cranial nerve number 1, olfactory, the smell test, is intact. Cranial nerve number 2 is the optic cranial nerve, and that's going to be the Snellen eye chart. And I will verbalize that we performed the Snellen eye chart prior to this assessment, and her vision is 20/20. Cranial nerve number 3 is ocular motor, and it's going to be the cardinal fields of gaze. So just watch my finger and don't move your head, just your eyes. Okay, so cranial nerve number 3, ocular motor, is intact. Cranial nerve number 4 is trochlear, and that's going to be pearless. So I'll use my pen light to check your pupils. So I will note they are at 3 millimeter, and then when they dilate, they go down to a 1 millimeter. I'm going to note that, can you follow my pen light for me? Okay. Cranial nerve number 4, trochlear, is intact. I'm going to go ahead and do my consensual, my direct lighting while I'm here. So consensual will be from the side, and I will note that the pupils do dilate bilaterally. And then direct, I will note that the pupils dilate to a 1 millimeter bilaterally. So cranial nerve number 5 is trigeminal. So I will have the patient close her eyes and let me know when she feels me touching her. So close your eyes and then tell me when. Okay, so cranial nerve number 5, trigeminal, is intact. Cranial nerve number 6 is abducens, and we already did Perla. Her pupils are equal, round, reactive to light and accommodation. Cranial nerve number 7 is facial, and can you smile? And can you frown? And can you raise your eyebrows? So cranial nerve number 7, facial, is intact. Cranial nerve number 8 is vestibulocochlear, that's the whisper test. I will close one ear and then whisper a 2-syllable word in the other ear.
Basketball.
Okay, so cranial nerve number 8, vestibulocochlear, is intact. Cranial nerve number 9 is glossopharyngeal, and that's a gag reflex, and I would verbalize that patient does have a gag reflex, so cranial nerve number 9, which is glossopharyngeal, is intact. Cranial nerve number 10 is going to be vagus. Can you say ah? So cranial nerve number 10, vagus, is intact. Cranial nerve number 11 is spinal accessories. Can you shrug your shoulders? Cranial nerve number 11, spinal accessories, is intact. Cranial nerve number 12 is the hypoglossal. Can you stick out your tongue? So cranial nerve number 12, hypoglossal, is intact. Okay, so all cranial nerves are intact, all 12 of them. At this point, I'm going to start with the patient's head, and I will note that it is normal cephalic in size and shape. I'm going to inspect her scalp and check for any nits or lice or unnatural inhabitants, and note there are not any noted. Palpating her scalp, I do not feel any nodules. Her hair is clean and soft and blonde. It's in a ponytail. I'm going to note that her eyelashes are evenly displaced. Her sclera is white. Her conjunctiva is pink. Her iris is brown. I'm going to note that her lacrimal ducts, there's no drainage. Is there any tenderness when I do that?
No.
So I would do that bilaterally and note there's no drainage or tenderness noted bilaterally to her lacrimal ducts. So now I'm going to go ahead and look at her ears and note they are evenly displaced on the head. I'm going to use my pen light and look for any external drainage. I do not see any. I don't see any lesions or anything. Now I'm going to palpate her tragus and note that it is white, pink and white in color. There's no discoloration, no nodules. Her auricle, there's no discoloration. It's pink and white and dry. I'm going to look at the nose and note that it is symmetrical to face. I will look for any septal deviation or lesions or drainage, and I do not see any noted. I'm going to go ahead and palpate the frontal sinuses. So close your eyes and just let me know if there's any tenderness when I do this.
None.
Okay, and the maxillary.
None.
Okay, so frontal and maxillary sinuses, there's no tenderness reported. So now I'm going to go ahead and look at the mouth, and I'm going to note that the lips are pink and dry. The teeth, let me get my gloves on actually real quick. The teeth are white and straight. There is no cavities noted, just several fillings. I'm going to go ahead and look at the tongue and palpate it for any nodules. So I'm going to use a piece of my little paper, and can you stick out your tongue for me? Okay, so there's no nodules noted. I'm going to go ahead and look at her soft and hard palate. Raise up your tongue. So soft palate's soft, hard palate's hard. I'm going to look at her uvula, and it is midline the throat. Her throat is pink with no redness. Her buccal mucosas are both pink and moist. I am going to grade her tonsils at a 2. Her tonsils are pink. There's no swollen, no inflammation, no redness. At this point, I'm going to palpate the neck. I'm going to take my gloves off and wash my hands or use hand sanitizer. I would palpate both sides of the neck and ask if there was any tenderness.
None.
Okay, and I would check the carotid bilaterally, one at a time. I got a 2+. 2+. I would have the patient perform range of motion. So can you do your head, your neck around, and then can you do it back and forth? So active range of motion is noted to patient's head and neck. So I'm going to listen to my stethoscope for any bruits and make sure there's none noted. So no bruits noted, and I will do that bilaterally. So at this point, I'm going to go ahead and have the patient sit back for me, and I'm going to examine the breast, and I would verbalize that I would palpate in a clockwise motion, feel in for any indulges or masses. I would do that bilaterally. I would squeeze the nipple with my index finger and my thumb to make sure there's no discharge bilaterally. I would also verbalize that I would check the axillary lymph nodes. I would have the patient raise her arm, and I would do the central, the scapular, the lateral, and the pectoral, and note that they are there within normal limits and intact. I would go ahead and note that the patient's chest is symmetrical to body. I would note that I'm going to go ahead and listen to her lung sounds. Actually, I'm going to listen to her lung sounds. So 5 in the front, 9 in the back. I'm going to go ahead and do the bronchial, and I'll place the stethoscope on the throat. And then for the bronchial vesicular, I'd place it in the middle of the chest. And for the vesicular, I would place it on either left or right side of the lung. So I'm going to go ahead and do the aortic, which is on the second intercostal space on the right side. The pulmonic, which is the second intercostal space on the left side. The tricuspid, which is on the 5th intercostal space on the left lateral side, and then the mitral, which is the 5th intercostal space on the mid-clavicular line. The mitral is also where I would palpate the PMI, and I would note that the PMI is also the 5th intercostal space mid-clavicular line, and it is palpable. So I'm going to go ahead and listen to the lung sounds. 5 in the front, deep breath. So lung sounds are clear, the auscultation anteriorly. I will do this posteriorly now. I will do 9 spots in the back, so just take a deep breath for me. So lung sounds are clear, the auscultation posteriorly. I'm going to go ahead and palpate the back of the chest, and we're going to go ahead and start here. Okay, so now I'm going to, I would note that I would have the patient sit up and I'll listen to her lung sounds. I'd also have her lay back supine and have her, I'll listen to her lung sounds anteriorly and posteriorly. So lung sounds are clear, the auscultation. I showed you where I would do bronchial, vesicular, and bronchial, vesicular. On the heart, the aortic, the pulmonic, the tricuspid, and mitral. I did hear S1 and S2. There was no murmurs noted. So at this time, I'm going to have you lay back for me, and I'm going to inspect your abdomen. So upon inspecting abdomen, I do not see any stretch marks, any nodules, masses, discolorations, any moles. I'm going to palpate the abdomen and just I'm going to start the right lower quadrant and let me know if there's any tenderness, okay? Any tenderness?
None.
Okay, so no tenderness reported, so now I'm going to percuss the abdomen starting at the right upper quadrant, and I will go in a horizontal line. Any tenderness? So no tenderness reported upon percussing. So when was your last bowel movement?
This morning.
And do you have any trouble going? When was the last time you urinated?
Probably about an hour ago.
Any burning or urgency or anything like that?
No.
Okay, good. So patient states her bowels are normal, her urinating is normal, abdomen looks good, bowel sounds are active times 4 quads. I'm going to go ahead and have the patient put her left heel on her right knee and run it down the shin for me. Okay, I'm gonna go ahead and I'm gonna touch your feet with no gloves, but they are clean. So uncross your legs and then push your feet against my hands. Okay, good. And then can you pat both legs with both hands? Good. Can you do your finger to each thumb? And can you do your finger to your nose? Okay. And then go ahead and raise your arm. Turn your palms like this. Raise your arms. Range of motion is active in shoulders. Can you do your elbows? And at this point, I'm feeling for any crepitus noted, and there is none noted bilaterally. And then can you do your wrist for me? No crepitus noted there. And then can you do your, go ahead and squeeze my fingers. Okay? So bilateral strength is strong in her grips. There's no crepitus noted in her fingers, her wrist, her shoulders, or her elbows. So at this point, I'm going to have the patient stand up for me. And can you act like you're going to dive in a pool? And I'm going to check your spine. I'm checking the spine for any scoliosis, and I do not note any. I do note that her cervical concavity is there, her thoracic convexity, and her lumbar concavity are all noted and within normal limits. Can you bend side to side for me? And then front, and then back. Okay? And while we're up, can I go ahead and do the heel to toe test? Okay? Good. So at this point, I'm going to check the reflexes. So I'm going to go ahead and do start with the upper extremities and use the small end of my hammer. I'm going to do the biceps, so I'm going to put my thumb, just straighten your hand, and then I'm going to put my thumb right here, and I'm going to strike my thumb. Okay? Tricep, I'm going to have the patient dangle her arm, and I'm going to strike behind her elbow. Okay? And then the brachioradialis, I'm going to grab her thumb. We'll do this one since you'll watch. And I'm going to strike her forearm. Okay, so now I'm going to do lower extremities. You can have a seat for me. I'm going to strike I'm going to use the bigger end of my hammer for lower extremities, and I'm going to strike beneath her kneecap for the patellar. Okay, and now I'm going to do the plantar superficial. I'm going to take this in and rub it from her heel all the way to her toes. It should make her foot curl. Good. And then I'm going to do her Achilles, and I'm going to hit behind her ankle on her Achilles tendon with this part. Okay, good. So I would do that bilaterally, and note that all of her reflexes are a 2+ on the grading scale, and they are all intact. At this point, I'm going to have the patient sit there, and I'm going to check her pulses, and I'm going to start with her dorsal pedial pulse. I would do all this bilaterally. I'm going to grade it at a 2+. I will do her posterior tibial on both sides and grade it at 2+. I'll do her popliteal, which is behind her knee, and I would grade that at a 2+ bilaterally. I would do her radial pulse bilaterally and grade that at a 2+. I would do her ulnar bilaterally and grade that at a 2+. And I would do her brachial bilaterally, and I'm going to grade that at a 2+. I did realize that something I would do with the heart is I would listen to the apical pulse and compare that to the radial pulse to make sure they're equal. So I'm going to go ahead and verbalize. I would do that for a minute. So I'm going to listen to the apical pulse, which is where the mitral pulse is, 5th intercostal space on the left lateral side. So I'm going to verbalize that in for a minute. I got 86 beats per minute, so I'm going to check the radial pulse just to make sure it's equal in strength to the apical pulse. And I get 86 beats per minute listening for a full minute, so apical and radial are equal. At this point, I'm going to have the patient sit there, and I'm going to I'm going to look at her nail beds and make sure that they are pink and there's no ridges. So upper extremities, they're pink. Capillary refills, less than 3 seconds, no ridges noted. Bilateral extremities, less than 3 seconds. Her nail beds are pink with no ridges noted bilaterally. Let's see. So at this point, I'm going to assess her sharp and dual pain. So I'll have you close your eyes and let me know what you feel. Okay, so tell me if this is sharp or dual.
Sharp. Dual.
Okay, I'll do this bilaterally. So I am going to say that would be the end of our assessment. So now at this point, I would gather up all my equipment, I would dispose of them, I'd wash my hands. I would also assist the patient back to comfort, side rails up ×2, bed in lowest position, call out them and reach. I would go back and document what I found, and thank you for coming today.